Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. I'm Dr. Padmaja Patel, President of the American College of Lifestyle Medicine. I'm both certified in internal medicine and lifestyle medicine and currently serve as Chief Medical Officer at Nudge Health. Each episode delivers 5 key takeaways from leading experts, innovators, and practitioners on how lifestyle medicine is reshaping the future of healthcare. Through practical strategies and real-world success stories, we empower you to make a lasting impact in your practice and beyond. Today, we are joined by a key executive leader from Humana, a national health plan partnering with the American College of Lifestyle Medicine to expand evidence-based lifestyle medicine training for clinicians across the country. Since announcing the partnership in 2022, Humana's Chief Medical Officer, Dr. Kate Goodrich, has underscored that motivating lifestyle change is critical to preventing and treating chronic disease and to lowering healthcare costs. She published a recent piece titled, Lifestyle Medicine Supports Better Health, Outcomes, and Lower Cost. As part of this effort, Humana supports clinicians pursuing ACLM training and certification, offering tuition reimbursement and other benefits to build skills in nutrition, physical activity, sleep, stress management, and behavior change. ACLM is also providing primary care strategies and patient-facing resources for Humana's primary care clinics. Humana is an active member of the ACLM Innovators Council, a group of thought leaders advancing lifestyle medicine within healthcare and within risk-bearing contracts or value-based care. With that opening context, we are excited to explore how this collaboration advances lifestyle medicine and value-based care. Please join me in welcoming our guest, Dr. Alex Ding, who is the Enterprise Deputy Chief Medical Officer at Humana, where he leads initiatives around physician engagement, clinician experience, value-based care, and enterprise strategy for clinician recruitment and retention. He's a board-certified diagnostic and interventional radiologist who continues to teach and practice as a clinical associate professor at the University of Louisville. Dr. Ding, welcome. How are you today?
I'm doing great, and thank you so much for having me on the vodcast today. I am just so excited to be here because lifestyle medicine and value-based care really belong in the same conversation. Both are about moving upstream, tackling the root causes of disease, and enabling a system where patients, clinicians, and communities all thrive. So thank you so much for having me today.
Oh, what a pleasure. I'm glad you are here today. So I know you recently said that the integration of lifestyle medicine is an important driver toward refocusing our health system to fully focus on patient health, prevention, and well-being. Could you elaborate on how and why lifestyle medicine is central to value-based care?
Yeah, I really see lifestyle medicine as a foundation of value-based care. I mean, if you really think about it, the chronic conditions that drive so much of our health system's costs and patient suffering, diabetes, heart disease, obesity, hypertension, are largely lifestyle driven. And those are exactly the conditions we spend the most money treating as well. So in a fee-for-service world, you get paid for doing more tests and procedures, which doesn't necessarily encourage getting upstream. But in value-based care, the incentives flip. And so now we're rewarded for keeping people healthier, for preventing hospitalizations, for keeping chronic diseases well managed, for preventing disease onset, for really helping people achieve better outcomes and a better quality of life. And I think that lifestyle medicine is central to that because it's about root causes, not just managing the downstream consequences. So Humana has really been at the forefront of this value-based care transformation across the industry for more than a decade. And we started off as a payer, building strong partnerships with provider organizations, physicians, and supporting them on their journey into value-based care models. Now today, over 70% of our Medicare Advantage members get care with clinicians and practices that are in these value-based care arrangements, one of the highest levels in the industry. And then we've also become a care delivery organization ourselves, operating over 300 senior-focused value-based primary care clinics where lifestyle medicine isn't an afterthought. It's really embedded into the way in which we deliver care. So every year we publish an annual value-based care report that kind of shows some of these proof points. In our most recent report, we found that members that are cared for by physicians in value-based care arrangements had better outcomes, higher rates of preventative screening, better control of diabetes and hypertension, lower hospital admissions compared to those in fee-for-service. And a lot of that has to do with the incentives that are built into value-based care, which is really focused on outcomes rather than volume, and really investing in addressing root causes of disease, for which one of the best ways to enable that really means building in lifestyle medicine components into the practice. So for me, lifestyle medicine, value-based care, they're perfectly aligned. They both ask the question of how do we get more years of healthy, meaningful life while reducing the waste and suffering that comes from a system that is focused too much on just the treatment aspect. And I think when we get it right, it really is the clearest example of what value in healthcare really means.
Yes, yes. And having that alignment around incentives is really key. And how do you support your clinicians in learning about lifestyle medicine as well as practicing lifestyle medicine?
Yeah, I would say one of the most important things that we can do as an organization is not just to talk about lifestyle medicine, but also to give our clinicians the tools and the confidence to practice it. And so that is why we so value our partnership with the American College of Lifestyle Medicine. We've had ACLM leaders and speakers present at our all clinician meetings so that every one of our physicians and advanced practice providers hears directly from experts and leaders in the field. We also make the ACLM's CME offerings available across our clinicians. We've even opened it up to our non-clinician employees and network providers, and we've gotten a great response to that as well. We also cover the educational and certification costs for our physicians who want to pursue board certification in lifestyle medicine. But beyond that, we've also co-developed practical resources to make it easier for clinicians to integrate lifestyle counseling into their visits. We've launched a lifestyle medicine interest group within the organization so that clinicians and, quite frankly, non-clinicians as well can share best practices, they can learn from each other, really build a community around this type of care, in addition to living it themselves. And I think the message is clear that this isn't something that's optional or fringe, that it really is central to how we want to practice medicine in a value-based world. But I would also say that supporting clinicians also means caring for their own health and well-being. We know that it is hard to pour yourself into patients if your own cup is empty. And so that is why we've created a physician health and well-being committee. We've invested in burnout coaching and resiliency training. We offer a wellness app that's available to all of our associates as an enterprise benefit that provides tools and even rewards for healthy behaviors. And these are really important steps, but I do also want to make it very, very clear that we don't see burnout as an individual failing. We see it as a systems issue. Just asking doctors to be more resilient isn't the answer. The answer is really fixing the system in which they practice. And that's where our work with technology is just one example that I thought would be interesting to share. So at CenterWell, we've been pioneering the use of ambient AI for clinical documentation. Instead of spending hours at the computer typing notes, physicians can now focus on the patient while the AI listens in the background and generates a lot of the clinical documentation. And the results have really been quite impressive and striking. So we've reduced the time that is spent on documentation by more than 30%. We've improved visit note quality, and clinicians have reported dramatically less after-hours pajama time spent finishing charts. And really, most importantly, we've seen some real reductions in burnout. This work was recognized by the AMA and their health services practices. And just this month, we were announced as receiving a recognition for their Joy in Medicine recognition, which we're really excited and proud of. And so when I really think about supporting our clinicians in lifestyle medicine, I think there's two sides of the coin. One, giving them the training and the resources to practice it well. And then two, making sure that they've got a system and a culture that supports their own health and professional satisfaction as well. Because I really do believe in my heart of hearts that when our clinicians are thriving, they are so much better positioned to help our patients thrive.
Absolutely. Very well said. And as a clinician leader, obviously, all of us are striving towards that. So thank you for emphasizing on clinician well-being, which is such a critical aspect of overall well-being. Not just, we need to focus on patients, but we also need to focus on our entire healthcare team. So tell me, how is lifestyle medicine actually currently integrated into some of your clinical practices and especially around those wellness centers?
Yeah, I mean, for us, lifestyle medicine isn't something extra. It's really
Sure.
embedded in the design of our value-based care primary care model. So every patient goes through screening for lifestyle-related risk factors like diet, physical activity, sleep, stress. And that really creates a foundation for shared decision-making and goal setting between the patient and the clinician. So to make this practical, we've co-developed toolkits with the ACLM that are co-branded with Humana, Centerwell, and Conviva. And these toolkits include evidence-based guidelines on nutrition, exercise, stress management, tobacco cessation, and they're also translated into multiple languages that are then accessible to the diverse communities that we serve. So that means that our clinicians have a consistent, trusted playbook, and that our patients have materials that they can actually use at home. Now, we also leverage individualized care plans to support behavioral change. So, for example, a patient with diabetes might have care plan goals around nutrition, physical activity, and sleep. And our team helps track progress over time. So it's not just about handing someone a pamphlet or writing a script for a medication. It's really about setting achievable goals, checking in, celebrating progress when that's been made. And another unique element is the way in which we bring together a whole multidisciplinary team. So our clinics employ activity coordinators who run the programming in our wellness centers. So things like exercise classes, healthy cooking demos, stress reduction workshops, and a favorite is bingo that really
Oh,
builds a sense of community and just gives them a place to get together socially. And the nice thing is that our clinicians often collaborate directly with these coordinators to shape these offerings so that the lifestyle advice that patients hear in the exam room is then reinforced by the activities that are available in the wellness center. And I really think that that continuity is really powerful. It makes lifestyle medicine part of the broader patient's lived experience and not
yes.
just limited to a clinical conversation. And so we've really seen some meaningful results as well. So our research team recently published a study in Health Affairs. It looked at the impact of value-based primary care models in Medicare Advantage patients. We didn't just look at our own model and our own clinics and our own patients, but we also looked at a similar model across the industry, including our competitors and our peers. And we found that compared to seniors who were in traditional fee-for-service care, patients in our model had lower hospitalizations, fewer unnecessary visits to the emergency department. They had higher rates of preventative screening, like for colorectal cancer and diabetic eye exams, and better control of chronic conditions like diabetes and hypertension. But I would also say, just as important, the study also showed gains in health equity. So we
Yeah.
saw improvements across racial and ethnic groups. And in many cases, the gap in access actually narrowed between these populations. And that reinforces something that we really deeply care about. That is, lifestyle medicine, when integrated into value-based primary care, isn't just about extending life. It's also about ensuring that those benefits are equitably shared. And so in our clinics and our wellness centers, lifestyle medicine is really part of the core operating model of how we deliver value-based care. And now we've got some peer-reviewed data to show that and to back that up as well.
Yeah, well, thank you for highlighting that study that was published last year. It's a very, very remarkable outcome in terms of very addressing equitable outcomes, making sure that everybody's benefiting from that. So, Alex, tell me, how does the broader care team in your value-based care model support lifestyle medicine, especially for clinicians and the interdisciplinary team members?
Yeah, I think one of the real strengths of value-based care is that it is fundamentally a team sport. I would say in a fee-for-service model, the physician often has to carry the whole load. That is short visits, limited time, not always the training to dive deeply into nutrition, exercise, behavioral change. But in a value-based model, the incentives are different because success is measured on outcomes and total cost of care, not just the volume of visits. You can design care differently. And that opens the door to bringing in team members that you don't usually find in fee-for-service primary care. So dietitians, health coaches, pharmacists, social workers, activity coordinators, as I just mentioned. And these team members really make lifestyle medicine more practical. So a dietitian might spend the time teaching patients on how to build meals or read nutrition labels. Health coaches can check in between visits, keep the patients motivated. Social workers and behavioral health specialists address stress, loneliness, food insecurity that can really derail healthy changes. And pharmacists review medication lists and help safely de-prescribe as lifestyle medicine hopefully takes hold. So let me just, share one simple example. So you've got a patient, a senior with type 2 diabetes who is on multiple medications. They're really headed toward insulin. Now, in a fee-for-service system, the physician might have had a 10, 15-minute visit, adjusted medications, and then have had to move on to the next patient. But in the value-based model, the physician really sets the direction. They talk about the possibility of lifestyle change, and then there's a whole team that rallies around that and around them. So a dietitian would help redesign those meals. An activity coordinator might get them into walking groups at the wellness center. A health coach can call weekly to celebrate these small wins and keep them accountable. And then over time, as you see A1Cs improving, weight coming down, physician can reduce and de-prescribe medications. And then more importantly, the patient really feels more supported. They feel more empowered. They feel more engaged in their own health. And I think that's the difference that a team makes. Physician might plant the seed of lifestyle medicine, but it's really the broader care team that waters it, that nurtures it, that helps it to grow. And I think patients feel that. They don't feel like they're just out there on their own. They feel like they're surrounded by a broader team who knows them, believes in them, and wants them to succeed. And so for me, lifestyle medicine thrives in value-based care because it's not resting on just one clinician's shoulders. I think the structure of value-based care actually funds and supports these broader care teams, and that is really what allows lifestyle medicine to truly take root.
Yes, and I have to say, I've seen some of those pictures of activity managers, doing exercise with patients and cooking demonstration and all those from your Humana, centers, and I think at Centerwell or other sort of practices. And it's always engaging and interesting to see the patient being supported in their journey, not just within the clinic, but even outside the clinic. So thank you for sharing those. Now, I know you are a big champion of lifestyle medicine, but I know it has not been easy for many other organizations to embrace this idea. So help us understand, what are the challenges of practicing lifestyle medicine in a value-based care world? And how do you think we should move past them? Any advice you have?
Yeah, and I do think it is really important to be honest here. Practicing lifestyle medicine inside value-based care is not always easy, and there are real challenges. So first, many clinicians are still working in this hybrid environment where fee-for-service dominates. They feel like they're kind of pulled in two different directions, working in two different models, having a foot in each canoe, as I would say. So on the one hand, they're being asked to see more patients, less time. On the other hand, they're being asked to invest in prevention and long-term outcomes. And that tension, I think, is very real. Now, second, lifestyle medicine itself also requires time and skill and teamwork, and physicians alone don't have that bandwidth to coach patients on diet, exercise, or stress management during a short visit. And so without a full care team, it can really feel aspirational, but not actionable or accessible as well. Thirdly, I would say patients themselves face barriers. It is hard to talk to someone about eating healthier if they don't have reliable access to affordable, healthy food. It is hard to prescribe exercise if a patient doesn't feel safe walking in their own neighborhood. And these are just some examples of social determinants of health that are often outside of the four walls of the clinic, but directly shape whether lifestyle interventions succeed. So absolutely, there are significant headwinds. But I do think the good news is that value-based care actually gives us a path forward. I think it creates the financial flexibility to invest in these care teams, in providing things like supplemental benefits for transportation or nutrition support, also in new technologies that make population health and care coordination less burdensome. And so it allows us, the best way I would say is it allows us to design care around the patient rather than around billing codes. And we've seen proof points that it works. As I mentioned, we publish an annual value-based care report just to show the latest data on how these models are improving outcomes. And I'm going to make a shameless plug here and say that if your listeners are interested in seeing the numbers and some of the stories behind this transformation, they can find it at our website, humana.com/VBC. And so I would just say that while the challenges are real, I am also optimistic. Lifestyle medicine and value-based care go hand in hand, and together they represent a model that is not only sustainable for the healthcare system, but also profoundly meaningful for patients and clinicians alike.
Wonderful. Well, thank you. Thank you for your insights. It's been an absolute pleasure speaking with you today, Alex. Well, we're out of time. I want to really thank you for your insights and generously sharing your knowledge and passion for lifestyle medicine. Thank you to our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians and innovators who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.